Nurse Aide Have Board Exam. Question 1. How should the nurse aide communicate with a client who has a hearing loss? Option A. Face the client when speaking. Option B. Repeat the statement. Option C. Shout so that the client can hear. Option D. Use a high-pitched voice. The correct answer is option A. Face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy. Question 2. Normal adult resting heart rate range is: Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 80 to 120 beats per minute. Option D, 100 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 3. A client has difficulty adjusting to a new facility. The nurse aide should: Option A, tell the client they will adjust. Option B, allow the client to express their feelings. Option C, leave the client alone to adjust. Option D, call the family immediately. The correct answer is option B, allow the client to express their feelings. Allowing expression of feelings helps the client process the transition. Telling them they will adjust, A, is dismissive. Leaving them alone, C, may increase isolation. Calling the family, D, may be appropriate but not the first step. Question 4. The Heimlich maneuver should be used when a client: Option A, is coughing forcefully. Option B, cannot speak, cough, or breathe. Option C, has a minor cough. Option D, is having difficulty breathing. The correct answer is option B, cannot speak, cough, or breathe. The Heimlich is for severe airway obstruction when the client cannot speak, cough, or breathe. A client who is coughing forcefully can still breathe. Encourage coughing. Question 5. A client with dementia becomes aggressive. The nurse aide should: Option A, restrain the client immediately. Option B, remove themselves from the situation and seek help. Option C, yell at the client to stop. Option D, ignore the behavior. The correct answer is option B, remove themselves from the situation and seek help. Aggressive behavior in dementia may indicate unmet needs or pain. The aide should ensure safety, step back, and seek help. Restraint requires an order. Yelling escalates behavior. Ignoring is unsafe. Question 6. The nurse aide's responsibility with advance directives includes: Option A, helping the client complete advance directives. Option B, honoring the client's wishes and informing the nurse. Option C, making decisions for the client. Option D, explaining advance directives to the family. The correct answer is option B, honoring the client's wishes and informing the nurse. The nurse aide must respect and follow advance directives and inform the nurse of any issues. The aide does not assist in completing advance directives, make decisions for the client, or explain legal documents to the family. Question 7. When weighing a client, the nurse aide should: Option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is option B, weigh the client at the same time each day. Weighing at the same time each day, example, before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 8. What is the correct procedure for taking an oral temperature? Option A, place thermometer under the tongue, close mouth. Option B, place thermometer under the tongue, breathe through mouth. Option C, place thermometer between the teeth. Option D, place thermometer on the tongue. The correct answer is option A, place thermometer under the tongue, close mouth. The thermometer must be placed in the sublingual pocket with the mouth closed. Breathing through the mouth or placing on the tongue leads to inaccurate readings. Placement between teeth risks breaking the thermometer. Question 9. What is the correct way to transfer a client from bed to chair? Option A. Pull the client by their arms. Option B. Use a transfer belt and proper body mechanics. Option C. Lift the client under the armpits. Option D. Have the client stand without assistance. The correct answer is option B. Use a transfer belt and proper body mechanics. A transfer, gait, belt and proper body mechanics protect both client and aide from injury. Pulling by arms can injure shoulders. Lifting under armpits can cause bruising. Standing without assistance is unsafe. Question 10. Which precautions are used for clients with MRSA or VRE? Option A. Airborne precautions. Option B. Droplet precautions. Option C. Contact precautions. Option D. Standard precautions only. The correct answer is option C. Contact precautions. MRSA and VRE are spread by direct or indirect contact. Contact precautions require a gown and gloves for all client interactions. Airborne precautions are for TB and measles. Droplet precautions are for influenza and meningitis. Question 11. Which of the following can cause an inaccurate pulse oximetry reading? Option A. Nail polish. Option B. Client holding their breath. Option C. Client sleeping. Option D. Client sitting up. The correct answer is option A. Nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath holding and sleeping can affect readings, they don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 12. A client with Alzheimer's disease becomes agitated when the nurse aide enters the room. The aide should: Option A. Leave and return later. Option B. Approach slowly and speak in a calm, soothing voice. Option C. Ask the client what is wrong. Option D. Call for assistance. The correct answer is option B. Approach slowly and speak in a calm, soothing voice. A calm, slow approach reduces agitation. Leaving may reinforce the behavior. Asking what is wrong may be too abstract. Calling for assistance may be needed if the client is a danger to self or others. Question 13. When measuring blood pressure, the nurse aide should place the stethoscope over which artery? Option A. Radial artery. Option B. Brachial artery. Option C. Carotid artery. Option D. Femoral artery. The correct answer is option B. Brachial artery. The brachial artery, located in the antecubital fossa, inner elbow, is the site for auscultating Korokov sounds. The radial artery is used for pulse counts. The carotid and femoral arteries are not used for routine blood pressure. Question 14. The nurse aide finds a client's oxygen saturation is 88% on a pulse oximeter. The aide should: Option A. Document this as normal. Option B. Report it to the nurse immediately. Option C. Reposition the sensor and wait. Option D. Increase the client's oxygen. The correct answer is option B. Report it to the nurse immediately. Normal SpO2 is 95 to 100%. An 88% reading indicates significant hypoxemia requiring immediate intervention. CNAs cannot adjust oxygen, that is a nursing responsibility. While repositioning the sensor might be attempted briefly, reporting to the nurse is the priority. Question 15. Which method of temperature measurement is considered most accurate? Option A. Oral. Option B. Axillary. Option C. Tympanic. Option D. Rectal. The correct answer is option D. Rectal. Rectal temperatures most closely reflect core body temperature and are considered the gold standard. Oral temperatures are affected by eating and drinking. Axillary temperatures are least accurate. Tympanic readings can be affected by earwax and positioning. Question 16. What factor is not known to affect vital signs? Option A. Pain. Option B. Age. Option C. Hair color. Option D. Exercise. The correct answer is option C. Hair color. Pain, age, and exercise all affect vital signs. Pain and exercise increase heart rate, respiratory rate, and blood pressure. Age affects normal ranges. Hair color has no physiological effect on vital signs. Question 17. What is considered a normal blood pressure for an adult? Option A, 90/60 mmHg. Option B, 110/70 mmHg. Option C, 130/90 mmHg. Option D, 140/100 mmHg. The correct answer is option B, 110/70 mmHg. Normal blood pressure is less than 120/80 mmHg. 110/70 falls within the normal range. 90/60 is low, hypotension. 130/90 and 140/100 are elevated and indicate hypertension requiring medical attention. Question 18. Restorative care focuses on Option A, curing the disease. Option B, maintaining and improving function. Option C, providing end-of-life care. Option D, replacing the client's abilities. The correct answer is option B, maintaining and improving function. Restorative care aims to maintain and improve the client's functional abilities, promoting independence and quality of life. It is not focused on curing disease or replacing abilities. Question 19. The nurse aide's role in rehabilitation includes Option A, performing all ADLS for the client to save time. Option B, encouraging the client to perform ADLS independently. Option C, telling the client they cannot do anything. Option D, leaving the client alone to figure it out. The correct answer is option B, encouraging the client to perform ADLS independently. The nurse aide's role in rehabilitation is to encourage and assist clients in performing ADLS independently to restore or maintain function. Doing everything hinders progress. Question 20. The nurse aide's primary scope of practice includes Option A, performing sterile procedures. Option B, inserting urinary catheters. Option C, assisting with activities of daily living. Option D, administering medications. The correct answer is option C, assisting with activities of daily living. The nurse aide's primary role is assisting with ADLS such as bathing, dressing, toileting, feeding, and mobility. Sterile procedures, catheter insertion, and medication administration require licensed nursing staff. Question 21. The apical pulse is located at the Option A, wrist. Option B, neck. Option C, apex of the heart, fifth intercostal space, midclavicular line. Option D, elbow. The correct answer is option C, apex of the heart, fifth intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the fifth intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 22. When feeding a client who has difficulty swallowing, the nurse aide should Option A, feed them quickly to minimize aspiration risk. Option B, place food on the affected side of the mouth. Option C, place food on the stronger side of the mouth. Option D, use only liquids. The correct answer is option C, place food on the stronger side of the mouth. Place food on the stronger or unaffected side to help the client control and swallow. Feeding quickly increases aspiration risk. Placing food on the affected side can cause choking. Only liquids ignores the ordered diet consistency. Question 23. The chain of infection includes Option A, pathogen, host, transmission route. Option B, air, water, food. Option C, bacteria, viruses, fungi. Option D, skin, blood, mucous membranes. The correct answer is option A, pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example, hand hygiene breaks the mode of transmission. Question 24. When caring for a dying client, the nurse aide should. Option A, keep the client's room dark and quiet. Option B, allow the client to express his feelings. Option C, change the subject if the client talks about death. Option D, contact the client's minister, priest, or rabbi. The correct answer is option B. Allow the client to express his feelings. Allowing a dying client to express feelings about death and dying is essential for emotional support. Changing the subject or avoiding the topic is inappropriate. Keeping the room dark is not necessary and may increase isolation. While offering spiritual support is appropriate, the aide should not assume the client wants clergy contacted without asking first. Question 25. A client who is confused becomes agitated. The nurse aide should. Option A, give the client a sedative. Option B, remove the client from the situation. Option C, use a calm, reassuring voice. Option D, tell the client to calm down. The correct answer is option C. Use a calm, reassuring voice. A calm, reassuring voice can de-escalate agitation. Sedatives require an order. Removing the client may be necessary if they are a danger to self or others. Telling someone to calm down often has the opposite effect.